Can Steve Harris take that file and literally blast it out to those participants and just say, we're experiencing some technical difficulty, please stand by?
Doing a song? Okay. Wally, can you hear me? I see
I
you're connected.
I can hear you now.
Perfect, we have everybody. Okay. All right, we're good. So give me one more minute. We're good to go.
Hello?
Hello?
All right, I'm going to put my microphone on mute just in case, okay? But I'm here.
You're live and streaming.
How come nothing's on video?
It's on the channel. The meeting is live, as I understand.
Good afternoon. Welcome to the second virtual town hall meeting, City of Palm Coast. Joining me today are my co-hosts from the health department. We have Bob Snyder, our health officer, who has been leading this response to our COVID-19 global pandemic that we are experiencing. We also are joined with, in City Hall, our city manager, Matt Morton. And virtually, we have both Dr. Stephen Bickle, again, our medical director officer for the health department of Flagler County. And we have Wally Inquino, who is the COO of Advent Health. Wally, I would first ask if you would give an update for our community as far as everything that's going on over at Advent Health Hospital, Palm Coast. Any update you can provide at this time would be helpful.
Sure. Thank you, Mayor Melissa, for allowing us to share some information here in this platform with our community. We are working hard here and making sure that our staff and all of our patients continue to be safe as they come to our hospital. And one of the things that we have been changing for the past few days, obviously, is the screening process and our visitation policy has changed. So we went from allowing only certain types of visitors in the hospital, and then we changed it to include the emergency department as well. Then we went through screening from all of the physician office patients to patients that are coming to our outpatient services. And also now we're screening every single employee, basically everybody that comes into this building, to make sure that nobody has a fever, nobody has any risks that we can address right away and make sure that they can go home and be treated right away. Those are the big changes that we made in the past few days.
Thank you, Wally. And Bob, I'd ask for an update from the health department now.
Yeah, thank you, Mayor. I'd like to share some data highlights. So as of this morning, total positive cases statewide is 14,747. Deaths number 296. Total folks tested 138,262. In Flagler County, total positives are 35. 29 are Palm Coast residents who are quarantined at home. Total lab tests in the county, 469, with a positive rate of 7%, which is below the state average of 12%. So I would like to comment about projections for the state of Florida. The estimates from the Institute for Health Metrics at the University of Washington were just cited by the White House and used by the state of Florida for predicting our day for reaching the top of the curve and peak daily deaths and hospital usage. The Institute used social distancing, statewide and local actions, like the governor's executive orders and Palm Coast shelter-in-place order, closing of the beaches, to predict the top. Originally, that date was May 3rd for Florida. It is now April 21st, 10 days sooner. This new prediction should result in 3,000 less hospitalizations statewide and few hundred less ICU patient days. This model assumes that all states will continue social distancing through the end of May, including the closure of schools, non-essential services and businesses, and that stay-at-home orders will remain. So please keep in mind that positive cases and deaths will still occur as that curve descends and flattens out towards the date of June 1st. Next, County Emergency Management is partnering with the Department of Health, our hospital, EMS, paramedics, several volunteers through Flagler Volunteer Services, such as retired nurses, to hold a community testing event at the Daytona State College campus in Palm Coast. Jonathan Lord procured 500 test kits, and final approval to use them is expected. The plan to pull this off is done, and the training of our volunteers, hospital staff, nursing students, and paramedics and health department staff is occurring today. Just like the federal government test sites in South Florida, our local site will prioritize testing of healthcare workers, first responders, and persons with clinical symptoms who had close contact with a confirmed case or someone 65 years of age and older with chronic conditions or someone who is immunocompromised. The county will absorb the cost of the lab test. We are partnering with a local lab that will provide test results within 24 hours to the Department of Health. Our public health nurses and investigators will then bolt into action to identify the close contacts for those who have tested positive. Finally, the U.S. Surgeon General, Dr. Jerome Adams, communicated that the next 2 to 3 weeks will be rough and sad for many Americans. With no vaccine, no antiviral medication, testing as many as we can, and social distancing are the best tools that we have. So we must continue the mitigation efforts and best practices that you have heard over and over again. Stay home, avoid others, work from home if you can, practice that rigorous hand washing, smother your face and mouth with your arm when sneezing or coughing, don't touch your face with unclean hands, and disinfect surfaces at home and at work.
Thank you for that update. We have decided on this town hall, we are going to move right into the question and answer portion. We have over 800 participants on this town hall, so we want to make sure we get to as many questions that have been asked of our residents. We're going to pose these questions to the experts that are in attendance today. We thought that was most helpful approach. And then we will, if have time, again, take questions live. But again, there are a lot of questions, so I would ask our residents and participants to please be patient. All of your questions will be posted following this town hall meeting up on our Palm Coast Connect page, and so you'll be able to get a lot of your answers as well. I'm going to first pose some questions to Advent Health. Some of them also pertain to the Department of Health, so I will look to our participants first and foremost. Is Advent Health Palm Coast ready for an influx of coronavirus patients? If not, why? Wally, can you please take that?
Sure. And the answer is yes. We have made significant investments in services, infrastructure, personnel, and technology so we can best serve our community. And some of the examples of what we have done is to prepare for different waves of a surge in case we face one. We have performed many drills throughout the facility so we can simulate what would happen if we have a surge. And we also set up the tent that is outside of the hospital here, so we are able to care for patients that are coming in that do not require an extensive service or attention from many physicians, so we can separate them and mitigate them as much as possible.
Okay. How do I get my N95 masks to healthcare workers? Is there
That's
a
a
way?
that's a very good question. So we have been receiving actually many donations throughout our community. So the best way for us to do this is to connect with our foundation department. Many already can do that by visiting our website, but we also created a donation hub throughout Advent Health so we can better organize all of these offers. And it is at adventhealth.com /COVID-19 relief. I'm going to repeat that. adventhealth.com /COVID-19 relief. And this is to help us coordinate as many people are reaching out to help by donating masks. Now, we had companies locally that donated some companies. For example, ICI Homes donated over 1,000 masks to us. We have Harbor Freight, our local store, that donated some PPEs for us. And we have community members also working in trying to purchase out there and then delivering for us as well.
That's great, Wally. How many coronavirus test kits does Palm Coast currently have, and are they located at Advent Health or the Health Department? Also, are those tests sent to Jacksonville with a 5-day return for results, or are they the 5-minute tests? I would first go to Wally if you want to respond as far as Advent Health testing, and then I will look over to you, Bob, for the Health Department.
Okay, Advent Health very early acquired some equipment that would allow us to do some testing and for our facilities, which allow us to alleviate the testing burden from our public agencies while providing patients and physicians expanded access to the test. We perform tests at all hospitals, including our urgent care facilities. Because of the limited supplies and resources, tests are only facilitated with a physician order or if patients show up in DD with all the symptoms. Unlike the flu test, which can be done quickly and on site, COVID-19 results are not instantaneous. So due to the increased demands placed on the labs performing these tests, we cannot accurately predict how long it will take for a patient to receive their results.
Okay. Bob, did you want to add from the
Yeah,
Health Department?
would like to, Mayor Holland. So the main organizations in town that have test kits available besides the hospital would be the county through emergency management. We just shared that Jonathan Lord had put in an order a month ago and was real persistent in getting test kits, and that's how we received the 500 that will be devoted to the community testing event that we hope will occur and expected to occur early next week. The Health Department, we just got a shipment in of 150 test kits. Now, we're doing testing throughout the day at the Health Department. Like just the other day, we tested 24 people. So we're going to keep a stock and inventory to deal with that daily usage. And then if we have any extra, we'll kind of add to the inventory for the community testing event next week. With respect to labs in general, there's over 250 commercial labs statewide that are doing testing. They are all in overdrive, and the demand is just so great that it does take 5 to 8 days for those test results to come back. and they come back to our surveillance system where then we get to see who the positives are. The Jacksonville lab that was mentioned by the person asking the question, that's one of 3 public health labs in the state, and so they're focused on doing the testing for the most vulnerable and for the priority groups in the state of Florida. That includes healthcare workers, those that work in nursing homes, and individuals over the age of 65 with chronic conditions. But what's good is that the public health labs, we get the results back within 24 hours.
Great. I'm going to now pose the question. This actually came in from Pierre Chestem from Flagler Live. I think this probably goes to you or to Dr. Bickle. We're told to clean surfaces obsessively, but let's say we've been in obsessive self-isolation for 2 weeks. With everyone healthy inside our P-section prison, I'm quoting Pierre, why should we still clean surfaces like friends if there's no evidence of transmission of COVID?
Dr. Bickle, you want to take that question and I'll add to it?
Sure. Sure. So I would qualify that first sentence, we're told to clean surfaces obsessively, to people, go ahead and clean surfaces strategically. Keep in mind how this virus spreads is that it's expelled from people's bodies, usually breathing or coughing, lands on different surfaces, then can be transferred by your hands or touching different surfaces. So if your house is free, if people haven't come into your house, or you haven't brought things into your house, it's not going to multiply out of the blue inside your house. So once you've been in there for 2 weeks and nothing's happened and you've self-isolated, it's only going to be when you have contact with the outside world that there's some, even theoretical possibility of exposure. So then it would be that you bring something into the house, depends how you want to, how seriously you want to take this, because there's a minimal risk if somebody drops off a UPS package at your door. I mean, it's possible, but it's pretty small risk. So if you want to try to deal with that, it's not that easy. But basically, it would be that whenever you go outside, into the public, and there's some potential risk of exposure, when you come home, you wash your hands thoroughly, which would be like at least 20 seconds with soap and water, which is thought to be better than just using hand sanitizer. And then you're done. Theoretically, could it be on a shirt that you have or a jacket or something? Yeah, but there's a limit to how much, you want to do with this. And if you want to really go full bore, you can. But mostly it's washing your hands after you've been exposed, or been outside, washing them thoroughly. And that kind of the second question, I can just go into at the same time, says how can we protect ourselves better at grocery stores, places like CVS and Walgreens. It's sort of the same thing, just, vigorous hand washing when you get home and then using your discretion the rest of the time.
That's great. Okay. What does one do if we suspect one or more symptoms associated with COVID-19 and are 65 years or over? They said a flow chart would or should be helpful. Did you want to take that, Bob?
Sure.
Okay, well, the flow chart's really easy because there's just one arrow. Somebody like this is priority 2, which is high on the testing protocol, and it's anybody with symptoms associated with COVID-19 over 65 needs to be tested. So if they can get it through an urgent care or through the one of the admin facilities or the doctor's office, that's fine, but they also can get it done at the health department. Those would be some of the 24 people that the health department tested yesterday, for example. So there's only one course of action to take in that situation is you need to be tested. The only exception might be very mild symptoms. If you want to wait a day to make sure it's not just a scratchy throat because you got dehydrated yesterday or something. But when it's clear that people usually can tell they've got any kind of upper respiratory symptoms, then in their category, somebody 65 or over, also anybody with comorbidities, other medical conditions, those people need to be tested.
And the only thing I would add is that, yes, if you got the clinical symptoms of the fever, temperature, shortness of breath, the cough, And if you had close contact with a person who is infected, that definitely would qualify for your needing to get tested.
So if you feel you have symptoms and you don't have a regular doctor, whom should you contact?
I would definitely go to one of the urgent care centers. If you don't have a primary care physician, or Azalea Health on the Parkway, they're doing testing. Of course, if definitely the health department, please call the health department if you do not have a physician. So, there's 4 or 5 places in our community where you can get answers.
Yes, Central
Bob,
Care.
I just want to clarify, one thing is, we're advising people to call ahead of time.
Yes.
Regardless of where they're going, right? Whether they're going to Azalea or urgent care, because not only if they meet the criteria, but also for determining if there's test kit availability there at each facility.
That's
So,
great. That's excellent,
Wally,
Steve.
did you have something?
Yes, I'm sorry. I just wanted to point out that the Central Care is also testing, but it is important for them to also call for, that's a good idea by Dr. Bickle, because they might have additional questions and to make sure they fit the criteria.
I'm glad Wally mentioned that. I spoke to 3 people in the community who went to the Central Care in Ormond Beach to get tested. So thank you, Wally.
So this one came in about, we can see online various projections at the country, in the country and the state levels. Have you seen a county or city level forecast other than New York City, et cetera?
I haven't. I've only seen the projections through the University of Washington and the Institute devoted to this, and it's at the state level. Steve, have you seen anything, projections for county or city level?
No, and a couple points. No, basically, but 2 points. One is that is a great website.
Yeah.
I would encourage people, if they have any interest in kind of understanding these things, how they unfold, to go on there. They can look at any country. It has the whole curve of cases and hospitalizations projected over, a couple month period. It's down to the state level in the U.S. The reason why we don't have it on a county level, it might make sense in New York, is you need a lot of data to make these models. And so you need like the initial caseload and things like that. And if it's just really early in there, you're just kind of guessing. So that when you get to too small numbers, the data are just not as reliable. But these are going to be posted on a website, right? These questions.
Yes, they are.
Okay, and it references that web page, and I've been on there a bunch of times, and it's a great website if you want to kind of just see how these epidemics sort of hit each area.
And again, it's the Institute for Health Metrics and Evaluation at the University of Washington. Check it out.
That's very helpful for our residents, again, to continue to see the trends. Wally, if you can repeat, what are the current screening standards for people entering the hospital?
Sure. So every employee, they are screened, including the temperature. Any patient that is coming to our patient area will be asked all of the questions provided, following the guidelines from the CCD. And anybody with a temperature of 100 or higher would not be allowed in the building. And even if you're here to visit a patient who is at end of life situation, if they present with a fever, unfortunately, we're not allowed to allow that visitor to come into the building.
So there's a question of, do we need to wear masks in public? How do masks work? Please explain the difference between aerosol and droplet transmission.
Dr. Bickle.
Yes. Well, let me start with the aerosol and droplet transmission. So aerosol transmission basically means that it comes out of somebody's mouth, usually through expiration, and somebody else could inhale it into their, upper airway or lower airway and get infected that way. That does happen. Not that much for not that many different illnesses, but it does happen. It's not thought to happen much, if any, with coronavirus, this particular coronavirus. What's mainly thought to happen with this is droplet transmission. Now, there are a couple exceptions to this aerosol business with hospitalized patients on non-invasive ventilation and high flow oxygen and things like that. But for the average person in the public, it's basically, this is droplet transmission, which means somebody coughs, or it can maybe to some high extent through breathing, comes out of somebody, it's in a little droplet, it settles on some surface, somebody touches it, then they touch their mouth, and it comes into them that way. So that's a very different mode of transmission. So with droplet transmission, somebody wearing a mask is actually getting very little protection because there's very little risk of them getting it that way in the first place. The exception being healthcare workers who are in very close contact with patients who are known to have coronavirus. So there's super high risk. That's why so many of them get infected even with precautions. And that's why it's so imperative that we provide these people with all the equipment they need. With that exception, the average person out in the public is not really protecting themselves a whole lot with masks. The main use of masks in the public is that some people will be going around with asymptomatic infections and could be, giving it to others. So they're wearing a mask would prevent them from spreading it. And then anybody with diagnosed coronavirus shouldn't be out in public anyway, but that would be a reason for them to wear it if there was somebody like that. But it's mainly the asymptomatic group. So people, and then there's this other thing that may be somewhat important, and it's thought to be a factor in Asia, is that it's kind of a signaling mechanism to people out in public to be careful, that that we're all kind of on watch. It's kind of a way of kind of communicating that kind of reinforce social distancing and just, all the things all the other recommendations. So I would say if anybody who wants to wear a mask, wear one. Right. The only super effective mask to prevent infection for a person are the N95 masks properly fitted. But any mask will have some effect. So I think Advent is now having all the people who work there wear masks when they're in the hospital, whether they have patient contact or not. And we're not dissuading anybody from wearing masks if they want to wear them. It's not thought to be as much of a priority as in these special situations.
Do you have anything to add, Bob? No. Okay, great. Move to a different set of subset questions. I'm going to pose some of these to our city manager. What city offices are closed, and the employees who are not working, are they still receiving their pay or using accumulated time?
So right now, all city facilities and buildings are closed. However, all of our offices remain open internally for staff. We ramped up extraordinarily quickly and have a bulk of our workforce working remotely and working very successfully remotely. We realize that our task day to day is to continue the business of the city, to serve our residents, and to continue to create public value. Again, we have exceptional remote work capability. We're taking advantage of that at the moment. We're also repurposing employees who did not have certain rework capability to, again, bring additional resources to bear as we work through this COVID-19 pandemic. I will also say employees now, as we have to comply, as most businesses do, with the Families First Coronavirus Response Act, which is a new mandate from the federal government, which means we are working with some employees who fit into high-risk categories or may be under suspicion of having contracted COVID-19. Those employees now have some federal protections available to them. But other than that, our personnel policies remain in place, and I will tell you the bulk, the majority, 99% of our workforce continues to function. We've adopted alternate work schedules and rotations to keep people distanced, but we have essential work that we will continue and are continuing to do on our community's behalf.
Thank you for that. So how do we enforce 6 feet of the social distancing? Currently, when you shop for groceries, at least half of the people do not respect any distancing. I know that we have sent out some folks from our planning department, correct, Matt, to work with a lot of the commercial retailers to enforce this policy, to ensure that they're requiring distancing within their stores. Do you want to speak to that?
Absolutely, thank you, Mayor. So yes, we have been communicating the messages of social distancing and those requirements that have come down through the various orders, but not only city order, but the governor's executive orders. We have been proactive in that communication about social distancing. When we've had complaints about businesses maybe not making it clear what social distances is, we have in fact responded, both in writing and as appropriate, before or after store hours, in person, to speak with store personnel or store management to say, please post, please make it more visible. I know those tape lines or different signs that people are putting on the floors or in the aisles are helping. And at the end of the day, I would encourage people to please, let us know through Palm Coast Connect if you're having an issue. And by all means, don't be afraid, in my opinion, to call a store. Ask to speak with the manager, and remind them that you would appreciate them to continue to emphasize and make aware social distancing measures, and make sure that they have provisions in their stores, whether it be checkout lines or aisles or other areas where people are looking to get those essential supplies, that we are all communicating with each other, having patience, but working together to stay socially distanced.
And I think it's important to note that I think the majority of our residents are complying with the stay-at-home orders that we've requested of them. I see a lot less traffic on the streets than we had before this event. But however, I can't stress enough the fact that, if you are in need of going to a local store, support a local business or restaurant for takeout or pickup, to be respectful of the policies we've requested for a specific reason. This is a global pandemic. This is literally killing people all over the world. So our part and our community's part is to really adhere to the requests and requirements that we've set forth. This is not going to go away until we actually see that flattening of the curve. And we know the next few weeks are going to be very challenging for us as a community as a whole. So we have healthcare workers that are working night and day that, need that line of protection. Our first responders,
Right.
those in the health department, the volunteers. So the more we can stay home, the less this spread of this disease, this virus, will occur. And so when we make these orders, it's not to necessarily punishing our residents. It's actually trying to help them and trying to help from the spread of this, again, horrific virus that is occurring throughout the world. And to that point, Bob, I'm going to ask you to respond to this, because I know the health department has taken the lead with the county in particular in closing certain parts of our community that you felt would be helpful, again, to mitigate the spread of this virus. So can you please speak to the Flagler County Commissioners and open the beaches as they have in Volusia County? Can you speak to a little bit about what decision was made and why it was made and how it was made?
Yeah, the decision was made in partnership with Flagler Beach and also the county. About 2.5 weeks ago, 2 weeks ago, Matt and I were interested, Police Chief Matt Downey and I were interested in just viewing around noontime how well people were practicing social distancing around the pier, on the beach, north and south of the pier. And it just was not enough. It was, people were just gathering too close, not recognizing, staying away, 6 feet apart, including a lot of senior citizens who were at park benches. So, Matt took photos, got back to Larry Newsome, and quickly a decision was made that we need to close the beach. The issue, though, if we were to open the beach part-time, like, or in a way similar to Volusia or Brevard County, what it'll do, it'll just bring more and more people, other than the locals in our community, to our community to access the beach. And we're just so concerned especially over the next 2 to 3 critical weeks. We're just so concerned about inviting larger crowds, and that would not be good from a health and safety standpoint. And by the way, this is being looked at on a weekly basis by the decision makers in our community. So we appreciate everyone's compliance over the next 2 to 3 weeks especially.
Thank you. So this is another media question that came from another one of our media partners, David Ayers, General Manager of WNZF. Is the individual and family stimulus based on 2018 or 19 income? Is it based on actual gross income or adjusted? If it's 2019 and you haven't filed taxes yet, or you file an extension, how much time till stimulus is valid? What does Palm Coast consider essential businesses, and should they further stay-in-place orders be issued? Can we identify some of those essential businesses? I would refer to the first part of the question, again, going back to the website that has a lot more frequently asked questions about the stimulus package. We'll put those on our site as well, the www.whitehouse.gov. Economic relief, American workers, families, businesses impacted. I know that Congressman Waltz has been doing a tremendous amount to try to respond to our residents locally with specific questions. I know that he's going to be visiting our emergency management departments. So I would also reach out to Congressman Waltz if you have specific questions. Otherwise, again, there's another website, FAQ, coronavirus.gov, financial-help, who is eligible for the economic impact payment. A lot of good information on both those sites. If you do have specific inquiries about the federal stimulus and how it applies to you, again, not only Congressmember Waltz, I know that our chamber is going to be hosting a webinar in partnership with a local business, and their law firm is researching a lot of the different aspects of that, so we will forward that to them as well and hopefully get you a response that will be posted on our website. The second part of that, Matt, if you want to reply and respond about essential businesses and how we're viewing those in the community as far as what needs to remain open if this does continue to further impact us.
Absolutely. So, just as a starting point to that question, great question. What we're focused on first and foremost is stay home, stay safe, only go out if you have essential business. And I think the more people that will comply with that reduces these concerns around what is essential and what is not essential. We have specific guidance at this point, not only in our mandatory shelter-in-place order, but the governor's shelter-in-place order that refers to federal government established businesses and functions under what's called CISA that are essential businesses and essential functions that remain open. Again, our messaging has been, rather than focus on what individual businesses should be deemed essential and staying away from that confusion, to put that responsibility on ourselves as a community trying to help each other to say stay home and stay safe unless absolutely necessary, unless you need to have essential services, unless you need to get food or visit the doctor. But we do have that information. We have our order, we have the governor's order, we have the accompanying articles posted in our virtual town hall that we try to very clearly articulate and let you understand just by a glance what is considered essential at this point. Should further orders be issued, is the second part of that question. We absolutely will continue to inform our residents through our single source of information, which is our virtual town hall on Palm Coast Connect. We monitor these orders and we're monitoring conditions with all of our stakeholders on a daily basis. So for now, we continue to have our facilities closed, again, as we mentioned at the outset, our trails, our parks, and public access, and we just, again, urge people, the more important thing to focus on is stay home, stay safe, only travel for essential business, and if you do, comply with social distancing. Now the masks as, again, a prophylactic and a signaling measure, but we will continue to monitor this as the days go by.
So I'm going to pose this question either to Bob or to Steve. I live in Pennsylvania. I own a condominium in Palm Coast. Am I able to drive down there?
Yeah, I don't, Pennsylvania is not one of the New York tri-state areas that we've been targeting in terms of, stopping folks at I-95 or the airports. Yeah, I don't see any issue with that at all from Pennsylvania. Driving here to Florida, and when you arrive, just as you're doing in Pennsylvania, practice the social distancing measures and good hygiene and everything that we're doing here in our community.
So to that point, what are we doing about the Airbnbs in our neighborhood? People are coming from New York and are acting like they're on vacation.
Yeah, this is not party time. Maybe it is, small family gatherings and friends. This is all about doing what's right. It's about being aware of and respectful of and concerned for your fellow citizens and human beings, and that's what it's all about. We do not have enough people to enforce every single neighborhood and every single home and who's traveled from where and where are they staying and knocking on their door. We just don't. So this is honor system, everyone, and so we just plead with everyone, especially over the next few weeks, to stay put, keep these social distancing measures in mind, just all the things that we've talked about, and just be aware and concerned about your fellow human beings.
Matt, I'm going to pose this question to you because this is obviously on the top of your mind often, our mind often. Which city revenues will be most affected by this pandemic?
That's a fantastic question, and most of the financial indicators we have as a city are what's known as lagging measures. So they report to us, 30 days, 90, 60 days, 90 days from the past. So we have a lot of general concerns right now, and I will say we've been monitoring the indicators we do have. One of the best indicators traditionally when all other data is absent is our building permit data. It's a measure of the essential, a core component of a community business is what value is being added to people's property, who's expending money. I will say those numbers remain very strong, which is a good sign. We've also been meeting repeatedly and will continue to do with economists, with our financial consultants, with our investment consultants. And so, we would anticipate if we look, and the best experience we have is the financial crisis back in 2008 and 2009. That's the most germane, exponential relevance any of us have right now in local government. And so we would suspect that we would likely see, or a possibility to see, impacts to general fund revenues, to potentially transportation revenues, and maybe, again, depending on how the state's going to react, in grant share for different projects or grants coming in. So right now we are definitely in monitoring and fact-finding mode, and we will keep on top of this. We know this is, obviously the budget is the most crucial issue here at the city, and so we're going to just continue to monitor, and we will inform people once we know what we don't want to create a bunch of what ifs right now. We're going to be cautiously optimistic, and again, we believe we have a duty to serve our residents and to be responsible. We'll continue to monitor and keep the best available data as we have it, and share that as it comes in with our council and community.
I know we had a virtual council meeting last night, and that was brought up as far as if you look at how the city pays for services. We can talk about road maintenance. Our road maintenance is primarily funded through the gas tax collection. So when there's not as many people on the road that are driving because we're asking them to stay home, that will be a direct impact to that revenue source. So we will have to make some decisions as a council on are we going to maintain less road miles until we can catch up, which is already an underfunded area within our budget. But similar to that, we have a lot of restaurants that are either not operational or are not seeing the sales tax revenue that they would normally see. And what we do with those projects, a lot of it goes towards our amenities, different pieces of capital projects. And so I think we will have to make some adjustments due to those projections. But I know Matt has provided to his council a lot of good financial forecasts, so we know you're monitoring it daily.
Correct, and those revenues that should stay strong, and I wouldn't be concerned, you know, as a community, we can have confidence in our essentials, like our water and sewer utilities. And so those essential sources that we all demand on are in good health, and I expect to remain in good health. So those are good indicators and good pieces of information.
So, again, Matt, I'm going to go to you, and then I have a couple questions for our healthcare teams as well. When are the code enforcers going back to code enforcing our restrictions? I know they have been assigned different assignments during this crisis, but since they only went around each section 2 days a month, why can't they continue that?
So they actually they were going around to sections more than 2 days a month. And what we're doing now is prioritizing our code enforcement resources. Again, as we are dealing with this crisis, we're prioritizing and utilizing resources that serve our community in the best way and provide for the highest degree of health, life, and safety. So we are, in fact, enforcing code restrictions. We're focused mainly on those fire, life, safety issues that, again, are crucial to our community. When we have the bandwidth right now, again, we have code enforcement's doing park monitoring for us to protect against vandalism, to ensure that park closures are being respected, to, you know, monitor and view equipment that may be idled in the field. So, you know, very important essential functions for our community. And as we have time and bandwidth or need arises, again, as you mentioned, Mayor, the social distancing contacts with retailers, that resource was our code enforcement department. So we have them very engaged. We have them being very proactive for our community's best interest. And as we have the opportunity, they continue to do their normal work rotations and viewings. And again, taking the best of a proactive approach we can. We will continue, as we do with our other services right now, to evaluate when they will be deployed back full-time into their in-field assignments. And I would expect that to occur again in a few weeks.
So this is a question that came in as well from one of our residents. I'm a good Catholic and Christian. It's amazing to me that this COVID-19 virus is happening during Lent and Easter. Is Palm Coast going to allow churches to have Holy Week Mass? I know I have been on a few calls with our faith-based community during this crisis. They've reached out to ask how they can help and be of assistance and not, again, cause further spreading of this virus within their congregations. And I know the governor's office, executive order, they exempt the...
Yes, they did. Religious activities are allowed, regarded as an essential activity.
So I do know a lot of our local churches have gone to the virtual services that they're performing. I don't know, Bob, if you want to make a recommendation. Again, you know, those are those large gathering spots that we really are very dangerous right now.
Yeah, we are concerned, Mayor, about large gatherings. I mean, the recommendation is that you want to avoid large gatherings of any more than 10 people. And if you are going to be in even small groups like that, practice being 6 feet apart from each other. I mean, that's all about safety and wellness and our health. That's just so important. Again, this is unprecedented. That's why this is so important to maintain our distance from each other. So if you're going to go to the church, religious activities, just practice that to the extreme. And, you know, of course, we can't stop anyone from having a religious service, but I'm Catholic too, and I love what Mother Ann Seton did this past Palm Sunday. Is, you know, Father handed out palms and gave a blessing to each card that came up, and a group prayer was done in the beginning. So, you know, look for opportunities like that. And my 91-year-old mom, Melissa, she's Catholic too, of course, and she just watches Mass at home every day, and she gets comfort and strength spiritually from doing that.
Yeah, again, just be mindful of it and be aware. So Wally, this question goes to you. How is the morale of the healthcare workers at the hospital? Is there anything that our community members can do to be helpful? And again, how are you helping those that are making a tremendous sacrifice right now?
Sure, that's a very good question. Fortunately, I can say that our staff is doing well. The morale is high right now, and there are occasions where we get a little nervous and stressed out, but things works out, and we're doing very well on that end. There are how can the community? What can the community do to help our workers, to help the morale? So just this past weekend, we had a very nice event where we had the community drive by at a specific time, the hospital, and beep their horns and say thank you with cards. You know, gestures like that make a big difference. I was present here, and I was walking around looking at some of the nurses that were on the windows before I came down to the emergency room, and you could see that they were very emotional about it, very thankful. So gestures like that, they go a long way. But we also have a lot of people from the community reaching out and asking, how can I help? Right. So like I said before, we're channeling everything through our foundation. But there are people dropping off stack of cards for our nurses and our workers. And let me just open up parentheses here. When we talk about the staff at the hospital, we are including our nurses and our physicians, but also there's a lot of other people working in here. The people that works in the environmental services, our IT, our security, engineering, in the kitchen, lab. So there's a lot more people that are working here that are basically in the front line, just like the nurses and directors. And so we need to make sure that we keep them whole. And that's one of our goals. Another way that, Mayor Melissa, that we're doing this in that I would say that actually has an impact in our community is making sure that for the departments that we are not opening anymore, for example, our outpatient surgery and some other departments, or where the volume has decreased, we as Advent Health, we are committed to continue paying these employees throughout the month of May. So we started doing that in beginning a few weeks ago, the end of March. We make the commitment to stay making all of these payments, and so they can receive their paycheck until the end of May. And just last week, the decision was made to extend that for another 2 weeks. So we're going into beginning of June with this commitment. And this is a big deal because over 70% of our staff, so we have over 1,000 employees, over 70% of our staff, they live in Flagler County. And so being able to receive that paycheck is a big deal. The only thing that we ask from our employees is to be willing to help in other areas. So, for example, if you come to the hospital, you see the screeners there. Many of them are nurses. Many of them are OR nurses, but they're helping out in that capacity. That's the only thing that we ask in return. And that gives peace of mind to the families and for our workers as well.
Thank you so much. And please bring our best back to everyone and let them know we're all in this together. So Dr.
Thank
Bickle,
you.
there's a lot of questions that continue to come in around testing, and I know we've answered the specific ones. There are a few more outliners, but can you speak to the fact about, I know it's very technical, but I think it'd be helpful for all of our listeners to understand the reagent question that keeps coming up. Are we doing follow-up tests to see if those that did test positive, is there an immunity to that? I know that you've been doing a lot of reading different material on actual different solutions that they're proposing. Can you just speak to that? Because a lot is happening every single hour with this virus, and the testing has certainly been on the forefront of many of our residents' minds. And it's not as simple as one just going, again, to Quest or a testing lab. There's a lot that goes into this, and it has to be a recognized laboratory as well through the Department of Health, and there needs to be a high percentage of the positive outcomes as well. Can you speak to that?
Sure. First of all, the thing that people need to keep in mind is testing has to be strategic. There has to be a point to it. So to just test people sort of randomly or without a purpose is not productive. And then the other thing is you don't want to be testing people who have a low probability of something, because it's just kind of a waste of tests. So the testing criteria have changed over time, and they will continue to change over time. In the first phase of this illness, there was basically little to no risk of getting it in the community. There was not what we call community spread. So with that going on, the point of it was to test people who'd been traveling, who'd been exposed to a known case, because those are the likely people to have this. Now there's community spread, so the rules have changed. The other thing, which is very unfortunate, pretty much beyond any person, any local person's control, is, we've had a perfect storm in terms of test equipment, test kits, availability of the reagents, of the swabs, not to mention the test, technology itself, and our major supply chain for a lot of this material is China, which was hit first and hardest by this illness. So it's made everything. It's just been very complicated. But the testing is shifting. But what people need to keep in mind is, what is the value of testing? Well, there's no treatment at this point. There's some potential treatments, and they might have a couple different roles. One is to prevent people with mild disease from getting it more severely, and the other is for people with, hospitalized patients to prevent, major complications and deterioration. Well, and those are just kind of speculative. I mean, there's hope for that, but there's no clearly known treatments. So most of the people are just going to be watching and waiting and see how they do. And if they get sick with respiratory symptoms, they need to be going to the hospital for supportive care. But it's mostly supportive care. So the biggest role of testing earlier would have been to more aggressively identify cases in the community and do case contact tracing and quarantining and stuff like that to limit the spread. And it's really unfortunate that we weren't geared up from the beginning. But we're not alone in that. I mean, almost every country that did a really good job with this had a lot of experience with the SARS epidemic in the early 2000s, and already had been through this drill. So they were already ready to go. And we've had to kind of learn on the fly. So, but in terms of the test, there's a couple different things that go on. One is there are two types of tests. One is to test for the virus. And the virus is present early in the course of the illness. Sometimes if somebody's negative and has a high suspicion of symptoms, they test them again a couple days later. And those are pretty sensitive tests. And so that's one test. And then the other is this antibody tests, which don't pick it up early. They pick it up somewhere between 5 and 10 days into the illness. So you can't use it to diagnose, but it can be very useful to tell if people have had this, especially people who weren't tested initially because the test kits weren't available, who had upper respiratory symptoms. And that can help you identify a group of people who are immune to this and don't need to exercise precautions. So and then the other use of testing is for surveillance, which is to get an idea of how many asymptomatic people, they're not carriers because they actually have the illness and then they get over it, but they have minimal to no symptoms during their course of illness, which is usually lasting a week or two. And to find out how much of this is out there in the community, to inform our strategies for how aggressive we need to be, how much we need to be ramping up the case containment measures and things like that, or whether it's time to get more aggressive with these lockdown measures or less aggressive. So it's a real changing landscape with this stuff, but it's all tied to two things. One is testing availability, and with limited testing, there was a strong prioritization process going on to make the maximum use of the test. And the second one is this changing strategy of how we're going to try to shift from these, total population measures to more selected measures to control this.
Yeah, Steve, diagnostic testing is what we're doing now to test for the virus, and you and I have had lots of conversations about this in the evening. The surveillance testing, what Abbott Labs has done with the rapid testing that is now available through them. You had shared with me, you thought that would be a big game changer. Can you talk about that a little bit more?
Sure. Well, you know, first and foremost, I think we all agree we need to contain this. But there is this ongoing debate about the trade-off between, you know, the economic devastation that we're experiencing and the health devastation. And it does appear that by being very thoughtful and strategic in our approaches, that we can shift back and forth from these more, area-wide measures like closing restaurants and limiting interactions of all sorts, to identifying to a more selective process where when the numbers are smaller and you've identified most cases, you can do it that way. You can have just aggressive quarantining and case containment tracking of the patients so that group is contained, and then the rest of the population is protected because you're not allowing spread into the general population. But that only works when you have a handle on it. The numbers are down enough that you can do that. It's very much, it's very critical for the long-term strategy, because this illness could be with us for 1 or 2 years.
That's, thank you so much. Again, it's a very complex issue, and so the questions are very helpful, and I also think having the experts that are really living this and every single moment, hopefully our residents will really gain a lot more information and knowledge. There's a couple questions, Matt, as well, I'm going to pose to you, because it goes back to that social distancing. It goes back to the decisions we're making at City Hall to help our healthcare teams help mitigate this. In regards to construction being considered an essential service, while I can see maintenance construction being essential, such as a plumber, electricians who are ensuring someone's existing home functions properly, I fail to see how new construction is something that needs to continue. Can you speak to that?
Sure, just in the sense that we are working with all of our businesses as we can to provide and post and, have the best accurate information we can on a daily basis. Like any other business that is still considered essential under the executive order of the governor, we continue to work to inform and work with and partner with businesses to make sure they are implementing safety protocols, cleaning measures, sanitation of work sites and vehicles. Allowing, again, those businesses that have that essential function label attached to continue to, do the work of our community, which is important. So we can speak, also from the city perspective, again, of how we're trying to help people with strategies of alternate rotations, different work schedules. We'll continue to monitor those as we have. So far, we have not, received a lot of complaints. I think our contractors, our building community has definitely stepped up to answer the call. As we heard early on, ICI, fantastic, donating 1,000 masks to Advent Health. So I would say that they are taking this seriously. It's not a free-for-all. It is being monitored. They are working through the building department. We are doing remote from our part. They're doing remote from the best part from their part, limiting worksite traffic. So again, I think the way it's being done at this point responsibly and in compliance, it will be allowed to continue.
And again, I think our role as a city government is to understand the dynamic of this virus, to understand the limitations we have as far as keeping our residents safe. And the only means we know that is effective is to ask people to stay inside as much as possible, to not spread the virus from one to the other. And then, again, if you are experiencing symptoms, make sure you're following up with your physician and getting the requirement of that either quarantine, self-isolation, and those measures that are being recommended. So I'm going to look at a few more questions, and I'd like to also ask our team members that are with us today for any further information that they know would be helpful as we progress week to week throughout this. And I will ask Bob to talk a little bit more in a moment about really the trends that we're seeing and how prolonged. I know you mentioned the date of April 21st as well, but what does that mean? What does that truly mean to our community? And what can we really understand the impact on how that's what's going to happen over the next couple weeks in advance of that? So I will ask one last question in regards to city services. I know that we've had questions about our garbage pickups and the times of, it's still 2 days a week, but we are asking for some restrictions as well. Can you speak to that, Matt?
Yes, absolutely. So right now, garbage service pickup days remain the same. We do have a couple of asks. One is we were recently informed, and it was noticed, and there's an article posted on Virtual Town Hall. We also did a lot of direct messaging that white goods currently are not being accepted. Now, a white good is a washer, a dryer, refrigerator, some type of appliance. The reasons those aren't being accepted is the facility that accepted those closed temporarily in relation to the COVID-19 outbreak. So for that period of 30 days, I think we have about 2.5 weeks left, and then we'll know more information if it's going to reopen in the interim. Another thing that we've asked is that no loose garbage, and that came directly from Waste Pro. You know, in this time of the way things are happening, please make sure your garbage, if at all possible, is sealed and contained inside a plastic bag and tied up. This is as much of a practical concern as it is a public health concern. And additionally, the other criteria are around recycling materials. Please be very careful to make sure your recycling materials are not contaminated. We'll tell you at this moment, if they see contamination, paper, if they think it's a paper towel or some other, the recycling staff is not going to pick it up to determine what it is. They're going to take that recycling and throw it away out of an abundance of caution. Again, of trying to limit the spread of any virus, bacteria, infections, anything. So garbage service remains strong. Our contractor, Waste Pro, has had a plan. We worked with them early on to make sure as an essential function we could provide for sanitation as a health issue. And they've executed very well on their plan. They remain in constant communication with us. But we do ask those three things. No white goods right now. Please make sure all your garbage is sealed and contained as much as possible. Please make sure your recycling is not contaminated with anything but those approved recycling materials.
So Bob, can you go into, again, what we should set the expectation for our residents? In certainly the next week, we'll have our virtual town hall next Wednesday as well, but I think it's important that they hear from you in regards to what they can possibly expect.
Thank you, Mayor. In the spirit of, transparency and honesty, the next 2 to 3 weeks are going to be rough and very challenging. As we are still ascending, reaching the top of the curve, that apex, which is expected on April 21st, we're going to see more and more positive cases, more deaths, possibly more hospitalizations for the folks who are extremely sick and dealing with the virus and the illness. So when that point occurs on the 21st, again, it's 10 days sooner than the original projection, which was May 3rd. So from a positive standpoint, that will mean less hospitalizations, less ICU patients, but if we stick to the social distancing measures and all the things that we've talked about, now it's time to continue to be vigilant, don't be lax, and then what we can expect during the month of the rest of April and the month of May is we're going to watch the descent now of the curve and of that bubble, but it's also going to include cases, deaths, people still getting sick, impacted by the virus, but less and less and less. And even after that, so imagine the month of May, we need to continue doing what we're doing with the closures and the stay-at-home orders, and take us through June 1st is what the model tells us. But then the summer months are going to appear. There's the speculation that we might have little bumps in the road, maybe small waves of the virus during the summer months, and of course we're truthfully concerned about the fall. In the fall, winter months, when flu-like symptoms and other healthcare issues surface. And definitely this could, as Dr. Bickle just said, we might be dealing with this for the next 1 to 2 years, definitely the next 9 months. So I'm sure that policy decisions will be changing during the summer, but I can assure you that public health officials will be asking everyone to continue to maintain the course, and we're just going to need to monitor and just be very wary when the fall months come. Steve, do you agree with that summary overall?
Yes, definitely.
Well, thank you so much. And, I would add to our residents, we are continuing to see a lot of input from our stakeholders. Our Palm Coast Connect page, our app, everything we have, we call that the one source of truth. That is accurate, up-to-date information from all of our partners for Advent Health, everything that's going on there, from our health department, from the county, our first responders and public safety tile, the business community. We have a business resource center on that page that actually updates all the information in regards to the federal stimulus monies, the local resources that we are applying, the local restaurants that are serving and still operating for takeout and pickup. We're not stating, don't support those businesses. We're just stating to stay safe when you're doing it and socially distance yourselves in an effort to help keep everyone safe. So please make sure everyone on here listening is part of the Palm Coast Connect team, but make sure you're informing your neighbors, your other community members, that we will continue to update this. We will continue to have these virtual town halls. This is a very serious moment for us, but I've also been very proud of the response of so many people in our community that really has stepped up in a tremendous way to help us in this moment. And Matt, did you have anything else to add as well?
Yeah, thank you, Mayor. I think one of the things everyone heard today is listening. One of the constant themes is that data is so important. It's so crucial. And we as a city, we're managing with data and we're making our decisions with data. And those are the best tools we can have now to do the right thing. And they're going to be the best history lesson we have after this is over to understand what happened and things we could have done differently or maybe even better. And so please help us. The way we get our local data is through Palm Coast Connect. When you view the web pages through the virtual town hall, we can see the volumes, not individuals, who are viewing those frequently asked questions or those different categories. It helps us prioritize our resources. When you create those cases, when you create an account and you're logging in those questions, again, on a daily basis, it helps us understand the rapid changing nature of people's concerns and how we as a city can rally our resources to serve you better and meet those needs to the best extent possible. If you're having difficulty or don't know how to sign up, we'll help you do it by calling our customer service number. We have resources available to get you signed up and get you an account and walk you through it again for some of our residents who may not be technologically savvy. But please sign up, log your questions, log your cases. It is giving us the real-time, day-to-day data to make the best decisions for our community, and we need your help in making this as robust. As Dr. Bickle said early on, we need large data sets to make the best decisions and get the best statistical profile. So we need more residents, and we need you to continue to engage in that with us, please.
Thank you, everyone. Sorry for the delay on today's town hall, but as you know, we're doing everything possible to communicate with our residents, so please make sure you're registering for next week's town hall. Stay safe, stay informed, and thank you to all of our stakeholders and partners, our healthcare workers, our essential workers, our frontline, our first responders that are, continuing to do business every single day, serve our community. So we're all in this together. Thank you.